NHS bosses have been accused of destroying the careers of whistleblowers who stand up to protect patients' lives. This is according to a Telegraph report today.
Yes, doctors claims they've lost their jobs with some suffering from extreme mental health issues, as reportedly bosses strive to bury any concerns. Well, the chair of the BMA, Professor Phil Banfield, stated today that doctors are being forced to choose between patient safety and their careers.
Yes, Health Secretary Victoria Atkins MP commented a little earlier.
The ability for professionals to report their concerns, to me, is a vital part of ensuring that our healthcare system meets the needs of patients and indeed of other staff members. And I understand that many of the reports that have rightly been focused on are several years in the making, as in they're perhaps a little bit more historical, since the steps that we have brought in. So, for example, NHS England has brought in freedom to speak up guardians in every health trust. What that means is there is a person whose responsibility it is to ensure that staff can report their concerns to this guardian so that they can then take action. We have also set up a confidential helpline for people who wish to report their concerns, and again we know that that is not only being used by clinicians but importantly cases are being dealt with.
Well, that was the Health Secretary speaking a little earlier. Delighted to say that we're joined now in the studio by the chair of the BMA Council, Professor Banfield. Phil, thanks so much for joining us. I suppose the big question, the worry many people will have, is just how prevalent is this issue of doctors not feeling like they're able to speak up when there are issues?
Well, sadly, it's all too common. The BMA did a snapshot survey this year of 1,500 doctors, and 6 out of 10 of them almost said that they'd raised concerns over the last 12 months. Only 50%, just over 50%, had said that they were having their concerns addressed in any kind of detail, and only 6% said that their concerns had been addressed fully. Now, this is in the background, of course, of our having a duty to patients by the General Medical Council to report patient safety issues. And what we find is that when we report this, it's not the safety concern that's investigated, but the person raising those concerns. And that's a very unsafe place for the NHS to be.
It's quite incredible and also, dare I say, horrifying, really, if patient safety is being put at risk in this way. As a doctor or a nurse, it is your duty to call out where you see things that are going wrong within the NHS. I wonder, I read your article and you claim that perhaps, and correct me if I'm wrong, but NHS bosses essentially care about their reputation more than patient safety.
But what I can do is report what it feels like on the shop floor. So this is the everyday lived experience of doctors and nurses trying to make the health service a better place. Now, in reality, despite those concerns, we do an enormous amount of good work day in, day out, 24/7 across the whole year. So, the times at which that has a knock-on effect are relatively small. But you've only got to look at the Royal College of Emergency Medicine's concerns that they raised about delayed transfer of patients out of emergency departments into hospitals, where they've estimated that 260 patients a week die because of those delays. I mean, that's a scandal that the concerns of professionals and medical experts go unheeded.
And yet there have been all of these new initiatives in recent years, these freedom to speak up guardians now in every NHS trust, confidential helplines, all of these things. Is it not enough, or what needs more to be done to create an atmosphere more than anything else?
Well, what we need to do is to stop stop blaming the messenger here. We've got a situation where if you raise a concern, you are likely to be the person that's investigated rather than the concern. And we need a no-blame culture like they have in the aviation industry. The difficulty with that, of course, is that sometimes you've got to uncover some uncomfortable truths about health organisations or the people running them. And there seems to be an awful lot of money spent protecting the reputation of these organisations that could be redirected, of course, into patient care.
Here's a very controversial solution. It's what the private sector does to stop whistleblowers and damage to firms being covered up. When someone leaves in scandal at the head of an organisation, they get what's known as a golden handshake. Lots and lots of money as a parting gift from the firm. It sort of means that the CEO of an organisation is not trying to cover up any scandal. If there's a scandal, they'll resign. And it will be uncovered, but they'll get a hell of a lot of money to go. That's what the private sector does. It would be very uncomfortable to imagine giving a scandal-struck head of part of the NHS or the NHS money to leave. But is there anything in that?
Well, I mean, what we see all too often is that health service managers just move from one part of the organisation to another part. Health service managers are unregulated. One solution might be to introduce regulations so that they become responsible and actually carry the can for the decisions that they make to run unsafe services.
Yeah, I mean, Phil, just lastly, this was the most shocking example recently was with the Lucy Letby case, and I know that's historic to an extent, but the fact that whistleblowers tried to, tell the NHS management, tried to tell those higher up that something was going wrong, horrifically going wrong, and it took so long for that to then, end in some kind of action.
Well, of course, the difficulty with the Lucy Letby case and Chester is that, the threat of the General Medical Council was made to the doctors involved. There is no equivalent threat that you can use to an administrator or a health board. But, the repercussions of what's gone on in Chester are still going on today. So, we are seeing health boards and the behaviours of health boards and trusts around the country still taking precedent over patient safety.
So what would you like to see the government do now about creating... You mentioned more regulation. What shape would that take? It seems like this is a very tricky thing because it's based on culture within an organisation, perhaps more than anything more firm, more real.
Well, I'm a consultant in Wales, and my observation of the NHS in England is it's become unclear who is responsible and running the NHS in England because the day-to-day management is devolved down to trusts and these ICBs. There doesn't seem to be one person in charge, and I think that would...
And yet, if you'll let me... wasn't the idea of that there's some sort of competition, that services get better? And, of course, the NHS in England has been performing better than the NHS in Wales.
Well, I'm not quite sure that that's true, but...
Waiting times are less in England than they are in Wales. Wales has seen a pretty tragic outcome in terms of the access to care, many people having to go to English hospitals just to get routine care.
Well, I think that's a debate for another day. But the difficulty with what's going on in England is the lack of openness and transparency. And as you say, it is a cultural issue here. You should want to know what's going on. If a patient or a member of staff says, this is a dangerous state of play to be in, then you shouldn't say, oh no, stop complaining. You should say, that's really interesting. We'll take ownership of that and we'll investigate it every time, just to make sure that what is going on actually is safe. It's very simple to do. It just involves a change of mindset.
And presumably the unions also, it is part of their job to try and protect these whistleblowers and make them sure that they know their rights and everything, guide them through whatever process there is. We're going to have to leave it there, but thank you so much for your time. Really, really interesting to get your perspective on